It seems the National Department of Health has just woken up trying to enforce a law that has existed for over 2 decades. On Friday, the department, through the Health Secretary, Dr. Osborne Liko, issued a circular asking all pharmaceutical companies operating nurse stations to shut them down. The circular quoted the Medicine and Cosmetics Act that has existed since 1999. The circular reads, the management of all retail outlets operating in PNG are notified that the operations of clinics or nurse stations within the same premises as the retail pharmacy is illegal. This is in breach of the Medicines and Cosmetics Act, Sections 13 1C and Section 27 1C, where the license holder has failed to comply with conditions of the pharmacy license by operating a medical clinic within the vicinity of the pharmacy premises. This news of closing down the nurse stations has not gone down well with some patients who prefer the nurse stations over public health centers and private hospitals. Two of the main reasons given were accessibility and a fast service.
Services at the main hospitals, it's too slow sometimes, and sometimes, we really need the medication fast, so that's the reason why we come here. And private hospitals are more expensive. Yes, it's affordable. And at least we can afford to get the medications that we want at the right prices. Like not more than 100, below 100, so it's okay.
I don't think they should close it down because it helps family. Like in the busy schedule, like for busy people who can go to the general hospitals, this makes it easy for us to come in and get treatment, like first-hand treatment, and then get medicine at the same time. So this is also a good option for families and for public.
Sampla all lesto treatem mo sa raitem parsolna to mi bala bola city pharmacy o sa gain option marasha no sa. O sa na mi basa isi area mi basa chimbas na kam sim service lo sa zol.
Everywhere where there's a station, the nurses are very helpful. They check us properly and then they give us medication. If they aren't able to treat us, then they refer us to another doctor or to the private hospital, especially with diabetes and all these things. Thank you very much. I think you should have it and not let the government get rid of it.
It's much easier for us rather than going, and then with the restriction as well with COVID, you have to get COVID clearance again and stuff like that. Whereas for city pharmacy and here, it's more convenient, like you just walk in and you get the help that you need. And at the same time, when you get prescribed medicine, you get supplied as well at the same time. So with the public hospital, that doesn't happen. You go, they prescribe the medicine because there's no medicine. Then you have to run off again to pharmacies.
Another woman says if the government is closing the nurse stations, they must provide a solution that will offer a fast service to assist patients like her, who rely heavily on the services offered by the pharmacies.
Oh no, not stopping. Maybe the clinic will help me plant the public. Because on public housing can be plant for security, put in plenty rooms. Now COVID all you say excuse for COVID plant room. Now na treating me online ni gat liglig sequel. Ina plan treatment hari apa? No gate. Mi plan ko sana bu iti ko no sa plan dai. No this la kan liglig sequel come up. Health department must provide good class service to people block especially inside the city. This our population e bula plantista lo settlement planti mi plan no work no time mi plan goal got extra fee blong or yet to la charging this la mi plan paying to kinota so la wala marasin ne so doctor maki mi plan ka money mi plan pa no ka to mi plan ko bien pa ni mani ka.
Almost all pharmaceutical companies operating in the country are running nurse stations with licensed nurses doing patient consultations. Consultation is mostly free. Patients only pay for the medicine. Shamin Poreambeb, National EMTV News.